Obesity treatment is not a one-size-fits-all approach. You deserve a treatment plan that is individualized to you. I'm doing a 4-part series about obesity phenotypes. This is a presentation that somebody has of why they carry excess weight and the treatment options that are best suited based on their phenotype. Last week we talked about hungry brain. Today we're going to talk about hungry gut. And who am I? My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. And I treat patients all throughout the state of Missouri via my telehealth practice, Missouri Metabolic Health. And I take the time to evaluate all of my patients and get a detailed personal and family history, as well as an idea of what their day-to-day life looks like, so I can tailor my approach and my recommendations to them specifically. And you deserve the same thing. And so if you're looking for an obesity medicine trained physician, I will include a link below so you can find one in your area. But if you do not have an obesity medicine physician that you could work with right now, it's still important to know this information so you can take it and apply it to yourself. You can know what treatment options are available, and you can bring that information to whoever is a part of your medical team. If you missed last week's video, definitely go back to listen to it. But today we're talking about hungry gut. This was diagnosed and identified through studies that took people and fed them a meal and did a imaging study that followed the food throughout their GI system. And individuals with hungry gut had the food in their stomach move faster than the average person. And what this resulted in real life and how that person was feeling is that pretty soon after a meal, that person was hungry again. So they would eat it the same, everyone would eat the same meal, and the individuals in that study would feel satisfied after that meal. But individuals with hungry gut, they would feel hungry sooner than their quote-unquote normal counterparts because the food was going through their stomach faster. We're going to talk about the treatment options that are best suited for hungry gut. There are medications, surgery, and lifestyle options available. The medications that are best suited for hungry gut are GLP-1 agonists. The reason these medications are optimal for hungry gut is that they slow gastric emptying. If you know anything about GLP-1 medications, you've probably heard this because this is related to many of their side effects. The slowing of the gastric emptying can cause nausea, acid reflux, and constipation in some patients. But if your stomach already tends to empty faster, if you take a GLP-1 medication and slow it down slightly, it's going to now be more as what an average person's stomach is emptying. And so now you're going to feel what an average person feels after a meal and have prolonged satiety, meaning that you are satisfied and full for longer periods of time, which makes it much easier to avoid snacking in between meals. Makes it much easier to stick to your 3 square healthy meals throughout the day rather than snacking throughout the day. And I've done a lot of videos talking about the pros and cons of GLP-1 medications, who they're best for, how they work, how to optimize them, how to start a GLP-1. I'll include all of those links below so you can watch any of those individual videos so you can learn more about starting the GLP-1, optimizing your health while on it, and how to manage any side effects that may pop up. So check that out below. And if there were any questions about GLP-1s that I have not addressed yet, please put that in the comments. I would love to make a video to answer your questions. If a patient with hungry gut is considering bariatric and metabolic surgery, the recommended surgery is a gastric bypass. The reason that this is more effective is that gastric bypass actually causes changes in the GI tract that are more likely to mimic our GLP-1 agonist. So patients with hungry gut are more likely to respond to a gastric bypass compared to a sleeve gastrectomy. I also always like to highlight that gastric bypass is what is recommended for patients who have obesity and type 2 diabetes, especially if the type 2 diabetes is difficult to control on someone's current regimen. The lifestyle recommendations for somebody who has hungry gut consist of starting meals with protein. And this can be up to an hour before a meal. Having a protein shake or a protein bar or cottage cheese or Greek yogurt or a hard-boiled egg or some other protein source before your meal will help to trigger the satiety signals after the meal and will keep you full in between your meal periods. In summary, somebody who has hungry gut gets satisfied with their meal, but soon after, in between meals, they're pretty hungry again. And the treatment options include, for medication, our GLP-1 agonists, for surgery, gastric bypass, and for lifestyle, starting meals up to an hour before with a protein. You can use any combination of these to manage your hungry gut if you have that phenotype. It's also important to remember, now that we've talked about 2 of the 4 phenotypes, you can have a combination of these phenotypes. And you may respond best then to have a combination approach to your treatment plan, which is again why it can be so helpful to work with an obesity medicine physician if that is available to you. Subscribe and stay tuned so we can learn about the next 2 obesity phenotypes. I can't wait to share more with you next week. Take care.